Zinc chloride paste, an all-natural compound with nearly 2 centuries of medical use behind it, still benefits patients with melanoma, according to Dr. Norman Brooks.
Zinc chloride paste is called an escharotic, which means a substance that penetrates into the skin and kills cancerous tissue. It's been around since the early 1800s, actually, and it was discovered to be the deepest penetrating one that has ever been found. What we've learned is that zinc chloride fixative paste locally kills the melanoma tissue when you put it on the tissue, but it also works like a vaccine, like a melanoma vaccine, and it stimulates total body immunity and resistance to any further growth of the melanoma. Dr. Mose treated melanoma cases for 30 years and had a consecutive series over that 30-year period of time, mainly very thick, deeply invasive melanomas. And when that series of patients was compared to conventional surgery, the Mohs chemosurgery melanoma patients compared to the conventional surgery melanoma patients, and statistically analyzed, the cure rate was found to be at least 50% better survival with chemosurgery over fresh tissue surgery. And that's a huge number when we think about interferon, for example. Overall, the improved survival is only about 4%. So it's really a remarkable improvement in cure rate.
Can you describe the technique that you employ?
As a general rule, you put the paste on the site, you cover it with the dressing overnight, the paste penetrates in, and you can perform a fixed tissue excision the next day. And you cut through the dead tissue, leaving a wall of dead tissue in place. And that wall of dead tissue is what stimulates this reaction that occurs. It maximizes in about 4 days the reaction to the dead tissue, subsides thereafter. And that's when the vaccine effect occurs.
Why do we not see any head-to-head studies on this? There's no large-scale research going on in this area. It's just remains somewhat of a medical artifact.
Well, it's an old-time medicine, but it consists of natural substances. So that means that nobody can own it. And these days, if you do randomized trials with the FDA, we're talking minimum $100 million. That would be minimum. And so if you do something like that, you're going to own nothing at the end. So it just doesn't happen. It's never going to happen.
This has been Michelle Sullivan with the Global Medical News Network.